Okay, so one of the things that I see with patients and in the initial phase of a TPLO procedure and going home is that we describe leash walking, and commonly owners will do leash walking as they normally would. So they'll just be at a length with no control and the dog going at its own speed in any which way direction, which isn't what we want. What we actually want is for the speed to be very controlled. So that needs to be done by placing your dog on a short leash, and we're also making sure that our pace is the pace that we want for the dog. So you can see that Vanessa is walking very slowly, and it does make the walks quite boring for the dog and for you, but what that means is boring is safe in this regard, in that she is controlled. We're not having excessive range of motion, excessive movement, and undue speed or uneven speed. The other thing that we can also do is that we can control and assist the dog with a towel. So we can place a towel underneath the tummy and around the belly. And what that means is that we're just gently supporting the hind limbs. It also allows us to be supportive in that if they stumble, we're there to catch them. It does mean that we also have 2 people leading the dog, unless they're very small and you're very coordinated. But then we're just gently walking forward and supporting with the towel. And if we circle back, good girl. So I'm just pulling up with the towel ever so slightly to support the hind limbs, but I'm not pulling back this way, and I'm not taking the towel too far forward that it's not doing any support from the hind limbs. And generally speaking, dogs won't need a towel assistance apart from in the first couple of days of being home, when they're very painful and sometimes reluctant to get up for toileting. But most dogs, the key thing is the speed with which you walk, and they need to match that. Good girl, sweetie.